Hello viewers, welcome to Health Profile. Today we are here at Virinchi Hospital. Dr. Natesh is with us, consultant orthopedic surgeon. Hello doctor.
Hello.
Doctor, what type of sports injuries you come across?
I come across sports injuries mainly around the knee joint and around the shoulder joint.
Okay.
They are the most common injuries in sports persons, and mostly football is the main thing, football and basketball, and recently kabaddi.
Kabaddi.
They are all kabaddi contact sports where the incidence of ligament injuries and tears are very high. Unlike in the West, there is a lot of incidents with shoulder joint with the javelin throw and all the things which they do with rugby, American football, all these things.
What they complain, doctor, about the signs and symptoms?
Most commonly sports injuries involve pain in the joint where if it is acute, I mean if it is early, if the patient comes to my clinic early, immediately after the injury, within 1 week's time, it will be swollen. The joint in specific will be swollen, and the functionality of the joint will be reduced, and he will complain of severe pain in the joint. And if it is prolonged, if the patient comes after about 3 weeks or 4 weeks, which also happens, the patient will have instability and laxity. That will be the main complaint of a patient.
What are sports injuries?
Sports injuries can be classified into broadly two types. Injuries which occur in professional sports. There will be professional athletes, professional people who sporting is their career, and they are like more specialized, usually rare, and if at all they occur, they will be very severe, and usually they will be detrimental for the career of the individual who have that injury. And many of the injuries that occur in amateurs, people who are not properly trained, and people who play sports just for fun, or weekend players, in these injuries. This group of people, they usually the injuries will be very minor and usually untrained because of lack of training and lack of the proper equipment, coaching and all, proper technique. These people suffer injuries who play just for fun and unprofessional. And professional sports people, they have sports injuries when they use a wrong technique, or accidentally also they will have sports injuries. And we have to treat those people with professional sports injuries very aggressively, because that's their career. And as far as possible, we will try to get them back to their previous level of sporting activity as early as possible. Usually it will take around 3 to 6 months.
How they should treat common sports injury immediately after happening?
Sports injuries in usually people who are not playing professional level of sports, the injuries will be usually muscle aches, muscle cramps and muscle catch, or around the knee we can think of meniscal injuries, meniscal tears, or rarely ACL ligament tears, and in around the shoulder joint there may be shoulder dislocations and tendon impingements. They are common injuries. And in professional sports, professional people who play professional sports, usually there will be ligament injuries around the knee, and in the shoulder there can be tendinopathies and shoulder dislocations.
Doctor, how to treat a common sports injury?
Common sports injury is quite a broad spectrum, and for that we'll have to see the type of injury, and depending upon the type of injury, the treatment plan has to be chalked out. Usually in acute setting, we'll have to deal with swelling and tenderness and unable to move. That will be the acute setting, and you will usually use ice packs, painkillers, and for investigation purposes, usually we will not be able to do clinical examination on patients with acute injuries, because they will be in severe pain and they will not be able to cooperate, and it is unjust. And we will subject them for MRI scanning. MRI scanning is required for people with sports injuries, because the ligaments and all are seen only on MRI, and X-rays don't show them directly.
Okay.
And of course we can get some indirect evidences with positioning of the bones and all, but better to get a MRI scan that will be clear, and once for all it will be done. And after evaluating and finalizing upon the structure that is injured, torn or partially damaged or totally damaged, we will have to plan our next step, that is treatment.
Doctor, is it okay to walk with sprained knee?
No, we can't walk with a sprain. Sprain is usually partial tear of the fibers of ligaments, and we have to take rest until those ligaments heal. And
how many days of rest?
Usually 4 to 6 weeks, ma'am.
4 to 6 weeks.
4 to 6 weeks we have to give rest to that particular ligament.
Okay.
I don't mean that they are not supposed to walk or do any routine activities. They can do that as well. But the thing is, that particular ligament has to be given rest. That means if anterior cruciate ligament is partially torn, as around 20% or 30%, then it's still stable. You don't have to be completely bedridden. You can still move around, but you have to avoid jumping, running and getting down stairs fast or things like that. And that will be specific to a particular ligament.
Doctor, what are the common injuries you found around the knee?
The common injuries that I find in my clinic are mostly meniscal injuries. Meniscus is like a cushion, that is also a type of cartilage between the thigh bone and the leg bone. They are like washers, and they absorb extra stress on the knee joint. And the second most common injuries will be anterior cruciate ligament and posterior cruciate ligament injuries. They are the most common injuries that I find in my clinic.
What is ligament, doctor, actually?
Yeah, ligament is a condensed collagen structure that is not as soft as muscle, that is tougher than muscle, but not as tough as bone. And they stabilize the joints, and they are attached to two bones, and they stabilize the joint, and they also determine the range of motion of the joint.
Doctor, what is a shin splint?
Yeah, shin splints and stress fractures people usually confuse.
Okay.
Both of them occur when people are training too fast and too heavily. Usually it occurs in soldiers who are under training, or police people who are aggressively getting trained, or people who are preparing for them to for some physical activity.
Okay.
So shin splint is something like small muscle inflammation of the muscles that are attached onto the shin bone, that is tibia.
Okay.
On the anterior aspect.
Yes.
And there will be some inflammation because of aggressive training which these people trainees undergo. And stress fracture, whereas, is literally a fracture that occurs on the bone. They are all different, and shin splints can be reduced with just rest and ice application and rest to the particular limb, and inflammation. Anti-inflammatory medications will also help them. Whereas stress fractures, the part has to be immobilized in a cast or slab.
Doctor, what is ACL and PCL?
Yeah, ACL is anterior cruciate ligament, and PCL is a posterior cruciate ligament. Anterior cruciate ligament injuries are most common compared to posterior cruciate ligament because of various reasons, its location and its strength. And anterior cruciate ligament, there are two parts, anterior anterolateral bundle and posteromedial bundle. Okay, they basically, the function of anterior cruciate ligament is both of them are attached from tibia, leg bone to thigh bone. And the function is they stabilize the knee joint in high level activities. That is like when you are standing on one leg and trying to rotate your upper body onto one side, the knee joint is stabilized by these structures. And when you are getting down stairs too fast, when you are running, jumping, your knee joint is stabilized by these structures. Okay, so when you have an injury of anterior cruciate ligament or posterior cruciate ligament, which usually does occur when you play football or when contact sports like kabaddi and all these things, this is most common. So when these in these sports you rupture your ligaments, anterior cruciate ligament or posterior cruciate ligament, either completely or partially, or sometimes they may not be ruptured, but they stretch too much that their function is lost.
Does this cause a serious injury?
Yeah, that is a serious injury, and quite often it is detrimental for the career of that sports person as well, unless it is treated properly.
Doctor, how do you treat ACL and PCL injuries?
Yeah, anterior cruciate ligament and posterior cruciate ligament, that's ACL and PCL injuries. They are most common and sometimes can be detrimental to the career of a sports person. So they have to be treated, especially in active young adults, and they have to be treated quite aggressively and perfectly.
How do you treat, doctor?
The treatment will be arthroscopic. That means we don't usually open the knee joint. We'll just make some 4 mm or 5 mm portals into the knee joint. There will be a couple of portals, and through these portals, one will be the viewing portal, through which we put our camera inside and we view the joint and we operate, and the other one will be operating portal, through which we'll do a surgery. Okay, and the thing is, the anterior cruciate ligament and posterior cruciate ligament doesn't have any active blood supply. So the chances of they healing by themselves or they healing when we suture them or something like that are not at all there. So we have to shave off the remnants of those torn ligaments, and we have to substitute in their place. We have to harvest the native ligaments of the particular patient, and we have to quadruple them, triple them, or quadruple them.
Doctor, do they need surgery? Otherwise, without surgery, are there any options?
We can't do surgery. We can't get away without surgery in those patients with anterior cruciate ligament and posterior cruciate ligament tear. The reason being, there is no blood supply to these ligaments. So that means they don't heal by themselves, or there is no chance for us to suture them up and repair them. So whatever that standard treatment will be, whatever torn ligaments are there, they have to be shaved off. We have to create a gap there, and in that place we have to put a new ligament. So the new ligament will be for host rejection and immune things. We'll usually harvest one of the ligaments from the same patient. Usually it will be it can be semitendinosus or quadriceps or patellar ligament. Anything can be harvested from the patient, and they will be shaped and put in such a way that in the place of this native ligament, and they will be anchored using screws or anchoring buttons onto the bone, and they'll function like his new ligament, on which they'll form a scaffold on which the ligament strengthens.
So how many days it will take, doctor?
Yeah, usually that's a good question. Usually once we do the surgery, the next day the patient will be made to walk with support, and after 14 days the patient will be coming for suture removal. At that time we'll mobilize the knee joint for flexion and extension, and for 1 month he will be walking with the help of braces and crutch support, 1.5 months. After 2 months he can drive his car, go to office and do the routine things without any supports, and after 6 months usually they can get back to their previous level of sporting activity.
After that they have to follow any medicines?
No, after surgery usually it will be routine like antibiotics to prevent infection and some tendon strengthening medicines. That's it. Not any specific medication is not any specific thing.
Doctor, is there any recent advances in ACL and PCL treatment?
Yeah, there are of course some recent advances and some experimental studies going on with stem cells, but of course not in India. Though
with stem cells?
Abroad, yeah, with stem cells they claim that the fibers, the tensile strength and all the fibers repair themselves, and PRP injections into the knee joint with ACL and PCL injuries, either with surgery or without surgery. There are some studies recently published from European journals and even US, which says that there is some amount of repairing that can be possible without surgery, and there are some surgeons who even after replacement they inject PRP into the joint with this new ligament that is there in position. But though all these studies are there, the standard treatment will be arthroscopic reconstruction of the torn ligament right now.
Is it affordable, doctor?
Yeah, quite affordable, and it's also covered under insurance schemes.
Doctor, how to prevent sports injuries? Yeah,
for preventing sports injuries, the ideal thing is one has to be, if people are playing for hobby, as a hobby or just for weekend games and family meets and all those things, they have to be a bit more careful and more cautious, because they are not trained to be performing. They may be performing previously when in their school days or college days, but now they have lost touch of that, and they should not try to experiment or try to reach the previous level of activity or stress which they used to do in their young age. So that is the first thing that they have to take care, and they have to train themselves for playing. The muscles proper warm up has to be there, proper shoes, proper dressing has to be there, sports dressing and all, to prevent most of the injuries. And for preventing injuries, in continuation to that, and preventing injuries in professional people who play sports, especially in US and all, the football players, they are given training how to fall without getting injured. That will be a part of their training from their coach. So they avoid the injuries, and that has to be in a purely professional environment. And how to roll to dissipate that energy, how to jump.
That's a nice idea.
Yeah, how to jump and all. The coaches there, it is part of the training they receive. Okay, that has to be taken seriously there.
Here?
Yeah, here.
What is exactly brain tumor?
You see, tumor means uncontrolled cell growth. If that happens in the brain, it is called as brain tumor. So suppose I say you all have got hurt or injured yourself, but you see after some time, even without any intervention, you recover. So that happens because the cell divides and they form their own cells, and you have the recovery. But if this cell division or multiplication happens without control, it forms a tumor. And depending upon the location, you can have, if it is in the brain, it is called as a brain tumor. If you have in the lung, then it is lung tumor or stomach. That is how it is. So this is simply, in simple terms, means a brain tumor.